Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll review electrotherapy precautions and contraindications. We'll focus on how to identify when electrotherapy is appropriate, when it should be used with caution, and when it should be avoided to ensure safe and effective patient care. Let's start by reviewing the most common indications for electrotherapy. First, pain modulation, which is typically achieved using pulsed or alternating current. Electrotherapy can also be used for muscle strengthening, such as NMES, which uses pulsed or alternating current. Another key indication is tissue healing and acute swelling. This is commonly addressed with high-volt pulse current, which uses a monophasic waveform. Electrotherapy can also be used to deliver medication via iontophoresis. This requires direct current. And finally, electrotherapy can support functional movement using FES. This is typically performed with pulse current. Each of these indications is linked to a specific type of current, which helps guide clinical decision-making. Now, let's walk through some common precautions and why they matter, rather than just listing them. First, consider changes in sensory perception. If a patient has absent or diminished sensation, they may not feel excessive intensity or irritation. This increases the risk of skin injury or burns. This includes conditions like peripheral neuropathy or areas of skin analgesia. Next, think about skin and tissue integrity. If the skin is already compromised, such as with wounds or certain skin conditions, it may not tolerate stimulation well. Adhesive allergies can also lead to irritation or breakdown. And scar tissue may respond differently to stimulation, which can affect both comfort and effectiveness. So in these cases, electrotherapy may still be used, but it requires careful monitoring and clinical judgment. Next, let's look at electrical and safety considerations. Some patients may have an aversion to electricity, which can affect tolerance and limit how effectively we can apply the treatment. Metal, whether internal or external, can also influence how current is distributed. It may increase current density in a localized area, which can affect comfort and potentially increase the risk of irritation. Now consider systemic and physiological factors. With cardiac disease, we need to be cautious, especially with electrode placement and overall stress on the system. Obesity can act as an insulator, which may reduce the effectiveness of the current and require adjustments in intensity to achieve the desired response. So in these cases, the goal is not to avoid treatment entirely, but to modify it based on the patient's presentation and response. Lastly, consider cognitive and communication factors. If a patient has cognitive impairments, they may not fully understand the treatment or accurately report discomfort. This makes it more difficult to monitor their response and adjust the intensity safely. Communication impairments can create a similar challenge. If the patient is unable to clearly describe what they are feeling, we may miss early signs of irritation or excessive stimulation. So in these cases, electrotherapy may still be used, but it requires closer supervision and careful monitoring of the patient's response. Now, let's move into contraindications, situations where electrotherapy should not be used. First, consider implanted electrical devices. Electrical stimulation may interfere with devices such as pacemakers or defibrillators, so electrotherapy is contraindicated. Next, think about sensitive anatomical regions. Stimulation over the carotid sinus, as well as the head and neck, is contraindicated due to the risk of affecting blood pressure and neurological responses. The thoracic region is also contraindicated in patients with cardiac dysfunction because of the proximity to the heart, and electrotherapy should not be applied directly over the spinal column due to the potential impact on neural structures. In these situations, the risk outweighs the benefit, and electrotherapy should be avoided. Next, consider local tissue and mechanical risks. Electrotherapy should not be applied over areas with catheters or shunts, as the current or electrode placement may disrupt these devices. NMES is also contraindicated in areas where muscle contraction could disrupt tissue healing. Now consider systemic and medical conditions. Pregnancy is a contraindication when treating over the abdomen or lumbar region. Electrotherapy is also contraindicated over areas of active malignancy. And in patients with cardiac arrhythmias, electrical stimulation may interfere with cardiac function. In these situations, the risk outweighs the benefit, and electrotherapy should be avoided. Finally, consider vascular risks. Electrotherapy is contraindicated over an area of thrombus, such as a deep vein thrombosis. This is due to the risk of dislodging the clot. It is also contraindicated over areas of active hemorrhage. Stimulation may increase blood flow and worsen bleeding. In these situations, electrotherapy should be avoided. That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.